All right, let's dive into a really critical and honestly often misunderstood part of preventing pressure injuries. We're going to do a deep dive on the Braden scale, and we're zeroing in on the moisture domain. So, when you think about stopping pressure injuries, what's the very first thing that pops into your head? For most of us, it's all about turning and repositioning schedules. And look, that's absolutely vital, but it's only one piece of the puzzle. There's another factor lurking in the background, one that can quietly undo all your hard work.
And that factor, it's moisture. It really is the hidden danger. For a lot of patients, the whole terrible process of skin breakdown actually starts with the skin just being wet for too long. It creates the perfect storm for an injury to take hold.
To really get a handle on this hidden danger, we first have to be crystal clear on what we're supposed to be looking for. When the Braden scale asks us to assess moisture, what does that actually mean?
Well, the official definition is actually super straightforward. We are measuring the degree, and that means how much and for how long, a patient's skin is exposed to moisture. It sounds simple, right? But applying it correctly, that's where the real skill comes in.
And this moisture can come from a few really common places. We're talking about the obvious ones, like urinary or fecal incontinence for sure. But don't forget about things like heavy perspiration or even drainage coming from a wound. Any one of these can create that constantly damp environment right up against the skin. Okay, this right here, this is probably the single most important key to getting the score right. I really want you to hear this. Your assessment is not about the patient's diagnosis. It is all about the reality at the skin level, how often and for how long that skin is actually staying wet. So why is this such a big deal? Let's take a quick look at the science of what's happening to the skin, because when you see it, it really drives home how high the stakes are. You can literally see the chain reaction here. It all starts with that prolonged wetness. That leads to something called maceration, when the skin gets all soft and white and just waterlogged. A macerated skin barrier is a weak barrier, plain and simple. Its ability to handle any friction or pressure just plummets, which of course sends the risk of injury through the roof. To put it as simply as possible, moisture makes the skin vulnerable. It basically gets the skin prepped and ready for breakdown. When you add pressure to skin that's already been weakened by all that moisture, an injury can happen so much easier and so much faster. Okay, so we get the what and we get the why. Now let's get into the how. Let's break down the practical 4-point scoring system that you're actually going to be using at the bedside.
The scale is pretty logical when you look at it. A score of 4, that's the best score, means the skin is rarely moist. You're just doing routine linen changes. A 3 means it's occasionally moist. Now we get to a 2. Very moist. This means the skin is often damp, and you're having to change those linens at least once a shift. And then there's a score of 1, constantly moist. This is for those situations where the skin is almost always damp, and you feel like you're constantly changing linens.
And here it is again. I know we've said it, but it is so important it's worth repeating. Your score has to be based on your direct, hands-on observation of what's actually happening to the skin, not just on an assumption. This brings us to what I think is the most advanced part of the assessment. This is where we move beyond just looking at a diagnosis and start applying our real clinical judgment. Let's talk about a huge trap that is so easy to fall into. A patient has a diagnosis of incontinence, so they automatically get a 1 or a 2, right? Well, not necessarily. Your job is to assess the reality of the situation. A diagnosis tells you there's a risk, but your assessment tells you how severe that risk is right now in this moment. Think about it. What if your interventions are actually working? If you're using really effective barrier creams, great high absorbency briefs, and your team is on top of skincare, and the result is that the patient's skin is staying dry most of the time, well, their scores should reflect that reality. They might actually be a 3 or even a 4, even with that underlying diagnosis. So before you circle that number on the form, run through this quick mental checklist. Just ask yourself 3 questions. 1, how often is this person's skin actually wet? 2, once it's wet, how long does it stay that way before we can get in there and intervene? And 3, is the skin integrity already compromised? The answers to these questions, that's what's going to guide you to the right score. So let's bring this all home. Managing and accurately assessing moisture isn't just another box to check on a form. It is a fundamental pillar of preventing pressure injuries. It's an active, protective thing that we do. So please, remember this. Getting the moisture score right isn't about paperwork. It is about protecting your patient.
Every single time you do an accurate assessment, you are performing an act of clinical diligence that directly keeps them safe. So with that in mind, what are you going to look for differently on your next shift?